Okay, hi everyone, hope that you are all doing well. In this video, we're going to be looking at abnormal heart sounds. Now, there are three different types of abnormal heart sounds. The first is got to do with loudness of the heart sounds. Secondly, it's splitting. And thirdly, it's going to be extra heart sounds, which we'll be looking at in two other different videos. In this one, we're just going to be looking at loudness. So we remember from the first video that S1 and S2 are the normal heart sounds. And we know that S1 refers theoretically, according to common understanding, to the closure of the mitral, which is over here, and the tricuspid valve. S1, the closure of the mitral and the tricuspid valve. And what we see in terms of loudness is that you can either have a soft S1 or you can have what is known as a loud S1, and they do have different causes. Now, to try and understand these causes, you can think of the flow. So remember, mitral stenosis, you have the blood going from the left atrium to the left ventricle, but now the mitral valve is stenosed, it's more narrow, so you have longer period of flow from the left atrium to the left ventricle. Now, in the normal physiology of the heart, you have a large amount of flow at the beginning from the left atrium to the left ventricle, but then this flow gradually decreases, and then you have the closing of the valve. But with mitral stenosis, the flow continues because there's a narrowing of the valve, so that by the time systole starts, the valve has to close quite rapidly. And they say that that is the reason why in mitral stenosis you have the loud S1. Then in addition to the loud S1, you can get a soft S1, which is caused by a first degree heart block and mitral regurgitation. And they say that this is because of the prolonged diastolic filling time, as well as in the case of mitral regurg, the failure of the leaflets, which comprise the mitral valve, from connecting or coapting normally. But I think the main thing is just to appreciate that with your normal heart sounds, S1 and S2, they can be loud or they can be soft. With the second heart sound, we usually talk about loud. We don't usually talk about soft P2 or soft A2. And remember, in the first video, I explained to you that we usually differentiate between the aortic and the pulmonary component of the second heart sound because there's splitting. So you should be able to appreciate the difference. We see that with the loud P2, you would get that usually in pulmonary hypertension, and the loud A2 in systemic hypertension. Now the question is, how would you know? Where would you listen to determine if this is pulmonary? Is this a loud P2 or a loud A2? Well, you would put it on the necessary region. So if you're hearing a second heart sound which is loud, and it's loudest in the aortic region, then that suggests that it's the aortic component that is loudest. And the same with the pulmonary region. If you hear the second heart sound loudest in the pulmonary region, it suggests that the pulmonary component of the second heart sound is loud, which would be suggestive of a pulmonary hypertension. So I hope this makes sense and that you have a better understanding of loud and soft heart sounds.